Welcome. I'm Dr. Robert Buchanan of the Center for Plastic Surgery. I'm going to talk about the Obagi skincare system, which I and many others still believe is the best system out there for maintaining your skin and rejuvenating it. My quest for skincare began in the 1980s when some of my facelifts still looked old. I finally figured out it wasn't what I had done or not done. It was the fact that I had ignored their skin. I then started looking for ways to improve the skin and actually got really good at it. I got very good results on the patients, such that some of them didn't even want a facelift after I had offered it to them if they did their skin first. About 1990, a friend told me about the Obagi Nu-Derm system. I went and took a course from Dr. Obagi and came back and started using it. And to my amazement, the results I got were 2 to 3 times better than what I had been getting with what I had been doing, in spite of the fact that the reagents used in his system were essentially the same things that I had been using. Well, I then kept using the Obagi system for a number of years, but was somewhat discouraged because it worked mainly to rejuvenate significantly sun-damaged skin. I had to find other ways to treat the younger patients or patients that really didn't have totally damaged skin. Someone else, Dr. Obagi's daughter, apparently was having the same problem. She then, after Dr. Obagi had sold the company to a pharmaceutical company, joined the company and started developing some products for them. What she then did was develop what's called the Susan Obagi line, which joined the Nu-Derm line as a continuation and an additive part of the Obagi line. Now Obagi covers the entire spectrum of skin from youth all the way through later life. What I did when I was trying to do all this was divide the skin into different types and different needs, and tried to do it as scientifically as possible. What I have done is divided skin care into basic, basic plus, and rejuvenative. All of this based on science. Basic skincare is for everyone, no matter what your age or who you are. It is what everybody should be doing. It starts off with a cleanser, and Obagi actually makes 3 wonderful cleansers: the Susan Obagi foaming cleanser, a foaming gel, and a gentle cleanser in the Nu-Derm line. You then need to balance the pH of the skin to have the skin functioning normally, because washing it changes the pH so that the skin really doesn't function properly any longer. The easiest and simplest is a simple toner. Both the Susan Obagi and the Nu-Derm line have a toner. But there are other things that can replace it if you have simple needs. My favorite is the Obagi Vitamin C Serum. It does the toning of returning the pH back to normal, but it also is an antioxidant to protect you from sun damage, an anti-inflammatory to get rid of some redness if you have any, and it stabilizes the lipid pigment cell, skin cell. The next thing everybody needs is a good sunblock, and it needs to be practical. Most of the sunblocks out there require that you put them on hourly if you're outdoors, or every 2 hours if you're indoors. This is not real practical. I'm good, I'm not that good. So Obagi has a number of sunblocks. All of them are physical sunblocks. They have to be washed or rubbed off in order to need to put them back on. The next thing that you need if you're over about teenage years is an exfoliant, something to take the outer dead cells off. This is very important because they cause your skin to feel dry. They also cause your skin to look dull and listless. By getting them off, your skin is brighter, and you don't need anything to make it feel moist, because your skin will be moist. Notice that in this discussion I have not said anything about a moisturizer. It is the worst thing women have ever done for their skin. It prevents the body from making its own moisture. So what you want to do is get the dead cells off, and the skin will take care of itself. Basic plus skincare is for anyone 30 years of age or older. And the reason for this is that about 30 years of age, the skin stops making collagen and elastic tissue on a natural, normal, continuous basis. So after that time, you need to add something to cause the skin to make them. Without them, the skin becomes thin and inelastic, and the muscles underlying the skin will cause the skin to wrinkle and crinkle, and all of a sudden you've got all these little wrinkles and crinkles everywhere. The two things that we add to basic skincare to help do this is a retinol or tretinoin, better known as Retin-A, to stimulate collagen, and Nu-Derm, a product presently made only by Obagi, to stimulate the body to convert some of that collagen into elastic tissue. The healing properties of the skin stay, and all you're doing is simply telling it to continue to do what it used to do naturally. If you have major wrinkles and crinkles, then we simply go to the maximum of the tretinoin using a 0.1%. Obagi makes that plus 0.05, 0.025, and then the Susan Obagi, for people that need less than just a retinol, makes a product called Retivance, which is probably the best retinol product on the market. If you then need care with getting rid of spots or pigmentary things, then you need to add hydroquinone, which is basically, by the time you've done that, you've gone from basic plus to hydroquinone, which is essentially the Obagi Nu-Derm line. Now, how do we decide what's right for you? Well, first of all, we look at your age, then we look at the condition of your skin, and then we decide, okay, what do you need based on these things? Less than 25, simple basic skincare. Over 30, basic skincare plus. Significant wrinkles and crinkles, basic skincare maximally with tretinoin. With pigment problems, Nu-Derm. Now, unlike other skincare, Obagi is transformational and backed by science, all the way down, including the Susan Obagi line. It protects from damage and reverses any damage that is already there. Now, the problems you might occur after you start: one, shedding of dead cells, last about 4 to 6 weeks. What you can do, if you can, is short circuit it with a micropeel or a microdermabrasion. Unfortunately, that is not available right now. The healing system goes into high gear, and that causes the body to do what it always does when it starts to heal something. It brings in new blood supply, and it then causes you to be red for a little while. Usually lasts for 6 to 8 weeks, and that's simply easy to cover with a little Jane Iredale or some type of other makeup. The other problem that occurs is initial dryness. Your skin has not been making its own moisture for a while usually, and if it hasn't, you feel dry. Now, as I said, we don't use moisturizers, but Obagi has come up with another product that works just as well without slowing down the process of rejuvenation. They call it Hydrate. Eventually your skin will start making moisture and the dryness goes away. Now, all of this is fairly involved. All of it is major care. It stimulates the body. It does things that no other system does. So how do we make sure that you're getting the results you want? How do we make sure that you're not overusing or underusing? Well, we follow you. That is one thing that we do somewhat different than most other facilities. We are going to see you back in 2 weeks at the very minimum to make sure that you're not turning too red, you're not having any problem, and make sure that's working. Then we're going to see you back at about 12 weeks, which is the initial time we treat you, and by that time you should be looking really good. And we start you on maintenance then. And then we see you back after you go back on the daily treatment, and then we will follow you after that to make certain that you are getting the results that you want and need. Skin is both our shield from and how we present ourselves to the outside world. Invest in it wisely. I hope I've answered any questions you might have. If I haven't, feel free to call. Our desire is to have you have youthful, beautiful skin. Thank you.